Hello, and welcome to Ethics on Call, the podcast of the Center for Theology and Ethics in Catholic Health. I'm Tom Bushlack.
And I'm Dan Daly.
And today we've got a really special treat for you. We have a live recording of a panel discussion from the conference that we hosted recently at Boston College, sponsored by the Center. And this panel is discussing the future of AI in Catholic health. And we've got some of the top leaders and thinkers in the world on health in AI today. So, Dan's going to take us into the a little bit more about the conference.
Yeah, thanks, Tom. Yeah, it was really an incredible conference. And what you're going to listen to in a minute is the final session of the conference, which was a panel where we had, as Tom noted, just these, really important and insightful thinkers on health AI. Brian Anderson, who is the CEO of CHAI, Sister Ilia DeLeo of Villanova University, Dan Roth, who is at Trinity, a C-suite leader at Trinity, Amy Milliken of Boston College, she's a nurse, nursing professor there, and Michael Pensina, who is at United Health and also Duke University. And, we had 200 people registered for this conference. The room was full for all of the sessions, and really an incredible group of participants as well as speakers. And the nice thing is that you will get to see the entire conference, all of the sessions. We will be posting these on YouTube in the coming months. So look out for those, especially the opening session, which was an excellent session where at the time Monsignor Renzo Pegoraro, he is now Archbishop Renzo Pegoraro, gave the keynote address. And Vardit Ravitsky, the president CEO of the Hastings Center, and Phoebe Yang, an industry leader in AI, who also now teaches at Stanford, responded to the Archbishop's keynote. And so just an incredible session as well. And again, you're going to get to watch those on our YouTube channel in the next couple of weeks. So the last thing is, before we get to the conversation here, is, there's a statement that we wrote up that was endorsed by nearly 60 members of the conference, 60 participants at the conference. It signed off on it. And I'd invite you to see that statement at theologyanethics.org. And it's a brief statement, but I think it represents a growing consensus within the field of Catholic healthcare on how AI should be adopted and used.
Yeah, and while you're there, sign up for our newsletter, and then you'll get notified when those videos that we're currently editing from the conference are posted. And we'll be doing that keynote first, and then all the panels as well, or breakouts. All right, so with that introduction, we're going to get right into it, and we'll come back at the end with just a very few brief thoughts, and then we'll wrap it up. But enjoy the panel discussion. It's very enlightening.
So welcome to this session, the Roundtable conversation with leaders from a variety of fields and backgrounds in AI and healthcare. And I've asked this group to reflect on the conference and take what we've collectively learned, and from their own disciplines and backgrounds, consider how AI should be used in the healing ministry going forward. What does it look like going forward? Some takeaways, some ideas to move us from this conference out into the practice of healthcare. We have a distinguished group. To my immediate left here is Brian Anderson, MD, who is the CEO and co-founder of the Coalition for Health AI, known as CHAI, a nonprofit launched in 2021 to establish consensus-driven best practices for responsible health AI. An internationally recognized author and digital health expert, Dr. Anderson is a leader in AI innovation, clinical decision support, and interoperability. So thank you for being here, Dr. Anderson. Sister Ilia DeLeo, PhD, is a Franciscan sister of Washington, D.C., and holds the Josephine C. Connolly Endowed Chair in Theology at Villanova University. Her area of research is systematic constructive theology. She is the author of 26 books, including The Hours of the Universe, Reflections on God, Science, and the Human Journey, which won the 2022 Gold Nautilus Book Award. Stepping in for Rod Hochman, who sends his regrets due to a travel issue, is Dr. Daniel Roth, MD, Executive Vice President and Chief Operating Officer of Trinity Health. He leads clinical and business operations across Trinity Health's full continuum of care, including hospitals and community-based care, and previously served as Chief Clinical Officer. Amy Milliken, PhD, is an associate professor of the practice at the Boston College Connell School of Nursing. She is an experienced critical care nurse and clinical ethicist, including having served as the executive director of a high-volume ethics service at a large academic medical center in Boston. And she was a member of the 2025 ANA Code of Ethics Revision Writing Panel. And finally, we have again, Michael Pensina, PhD, is United Health Group's Chief AI Scientist, where he leads data science initiatives to enhance the organization's innovative use of responsible AI systems. He is also an adjunct professor of biostatistics and bioinformatics at the Duke University School of Medicine. Dr. Pensina has authored or co-authored 400 peer-reviewed publications. We have a great group here for this session. Thank you all for being here. And the ask that I posed to the panel was that they would begin with a short 1.5 to 2 minute statement to that prompt. Where ought we be going in healthcare, in Catholic healthcare, regarding AI in kind of broad strokes? And what are the takeaways? How do we answer that question in light of the conversation that we've been having for the past now almost 24 hours? So we'll do that, and then it'll be an open conversation among the panelists. I'll recede, and you can ask each other questions, respond to things that you've said or you've heard, and then we'll reserve a good chunk of time to open it to conversation coming from the participants in the audience. So, Dr. Anderson, I'm going to start with you. As you think about AI in healthcare in general, but in Catholic healthcare, and you could take it in either direction, where do you think it ought to be going? And that's a normative question, not about where it is, but where ought we be going in this way?
So when we started CHAI 4 years ago, it was all about, the traditional kinds of AI that have been around for some time. This is before generative AI. The expert risk classifiers that are helping to identify patients with sepsis or with diabetes, and using all the data that we have at our hands in the healthcare delivery systems to be able to do that. And then as generative AI has come along, the question has become, I think, really critical about how do we use these tools, right? They're incredible use cases that many health systems are. I apologize, I haven't been with you guys for the whole day, but I can only imagine, given the health systems that are here, the kinds of examples that folks have shared. One of the challenges that we've encountered in CHAI is, as you look at the use cases in the generative AI space, as you talk more about these agentic, semi-autonomous uses, very quickly, you begin running into this challenge of how do we develop best practices when values are front and center? If I'm a health system, thinking about deploying an agentic tool, and I really like the definition earlier, I use it too, an agentic tool that has a complex multi-step process that's in a semi-autonomous environment that might be engaging with a patient, where values for that patient are personal, they're intimate, it's their health. As a healthcare delivery system, how do I ensure that those models, those agents' values are aligned to my health system, to my faith tradition? This issue is called the alignment problem in the AI engineering space. And I think it is perhaps the most existential, critical issue that we as a society need to be facing. If we want to unlock the power of AI and all the magical, wonderful things that it can do, there's an increasing risk in those use cases. And we need to be sure that we can trust that these models understand us, that they understand our values. How we evaluate models for their alignment or misalignment to our values as a faith is really important if we want to trust these models. So as a Catholic Healthcare Association and a group of health systems and thought leaders, I would assert developing an evaluation framework and a development framework, but the ability to evaluate these models for their alignment to our faith's values is perhaps one of the most important questions and areas where we as a group can speak into.
Thank you, Dr. Anderson. Sister Ilya.
Thank you. Well, I come at this from a slightly different perspective. I'm a theologian who works at the intersection of theology and philosophy. As I'm thinking about the way AI intersects with the human person and human becoming. So a lot of the discussion is placed on artificial intelligence, and honestly, I learned a lot today, especially. And yet, I think the most important question I heard today was, can AI make us more human? AI is really a mirror of the human person. We're creating it. What we're doing with AI is ultimately what we want, what we desire. And I think it's really calling us to evaluate ourselves. What are we? And that's where I think I was thinking of the way the Catholic tradition puts forth certain values of the human person. But as I think of the wider discussion around AI, the non-Catholic discussion, one would not look at these values, which I truly value, but a lot of the talk is on transhumanism, post-humanism, that the human person is, in a sense, in a state of evolution. And therefore, technology is going to lead us to this new state. And this is where I think the Catholic tradition pulls us back and says, no, there are certain qualities here and characteristics that are godly. I mean, they are, in a sense, distinguish us in this overall scheme of life. And just calling out some of those, I mean, the dignity of the human person, which is more than just an intrinsic principle. There is something, what we call the image of God. There is something godlike of the human person. And I don't think we can easily just digitize that. We can't just export that into another medium. I very much value the emphasis on solidarity and option for the poor. And what does that mean in terms of this algorithmic bias? And therefore, I guess what most important is, how do we take that model of Jesus as healer in a world now that is increasingly post-human? And I think that's the challenge. I think Catholic healthcare is actually, if I take it at face value, it's countercultural. And so that's the challenge here. It's a very large, complex system of systems that has to now navigate its way in a complex world of competing systems. And not only for money and the most upscale, software, but at the same time, we're trying to balance, and trying to hold up in relief that the human person has a special role here, a special place. And I guess that is, if I were to think about that some more, I was particularly impressed by Dr. Gonzalez's presentation this afternoon, because it's about presence. How does the human remain present to another human in an AI world? And it's not just having the chat box give your a best read outcome, but it's about vulnerability. It's about the ability for a healthcare worker to weep with those who are weeping, to suffer with those who are suffering. And that's an openness to an element of life, to a dimension of life that cannot be downloaded, what we call the divine, what we call love. And so I think we have to not just place the emphasis on AI. The emphasis has to come back to us and constantly reevaluate, who are we in this AI evolving world, and what are we becoming with it?
Thank you, Sister Ilya. Dr. Roth.
Thank you. I'm already taken by the various perspectives, right, for the last day plus, and even sister's perspective. And I very much appreciate the notion of Catholic healthcare as a countercultural element. I hadn't thought about that previously, so thank you. But we all bring different perspectives. So I bring the perspective of having left as a primary practice as a primary care physician almost 20 years ago, with a commitment to making healthcare easier for our caregivers, for whom it's way too hard, but especially easier for patients. And having cared for patients for years, it's way too hard to be a patient. And so committed to that, and committed to trying to be part of a health system that would be accessible and safe and equitable and affordable, and having fallen short of that for those 20 years, right? High aspirations, a lot of progress, but still very, very short of that aspiration that we owe our communities and our patients. And I came to Boston bringing with me a significant enthusiasm for what this technology, what these opportunities are going to bring for us to be able to solve that, right? We're at the most exciting time that I can think of in my professional career for our ability to solve that. Now we have to do that thoughtfully. And so I would reflect an earlier time when I was almost as excited was 15, 20 years ago when we were implementing electronic health records, right? And as Ryan and Tom pointed out earlier today, and even in a brief example, we missed the mark on that by a mile. That didn't turn out to be anywhere near the transformation we thought it would be. Some improvements, but a lot of steps back. And we need to incorporate the lessons learned from that as we go forward. And one of the lessons learned, which I'm working to live into at Trinity, is we need to have all the right people around the table to make the right decisions with the right things and the right goals in mind. And that's where I think Catholic healthcare in these last 24 hours really emphasized the point of what Catholic healthcare is perfectly situated to help us actually achieve the aims and the best of what this can be. I had a lot of my talks on AI right now on promise and peril, and how do we maximize the promise and minimize the peril. And I think, Catholic healthcare is perfectly situated to do just that within an industry that needs that, right? Because we're an industry that's profoundly distressed. And so that's exciting. And that's where I think having the collective wisdom, one of the things I've learned in the world of AI the last few years is we used to think at Trinity Health we're big and we can do all these things. And it turns out we're dramatically subscale in this world. But Catholic healthcare is not subscale to address these types of issues. And so bringing together the collective wisdom of the people in this room, of ethicists and clinicians and caregivers and operators and theologians, to really bring forth and ask these questions and engage the right people to get to the right answers is a thing that Catholic healthcare is uniquely situated to do, right? That we can actually address these things. And remember, this is just the beginning. The things we're talking about today are a fraction of what's to come and the complexities that come with them. But I think it's a great opportunity. And I would love to see situations like Catholic healthcare coming together with companies like Epic to understand, how are you approaching this and how are you thinking about it? Because this is how we think about it. And we want to put forth the importance of dignity of the person, dignity of the caregiver, the importance of equity and sustainability within that and subsidiarity. We need to make sure those things are prominent, and we can be a voice with the industry as well to do just that. So I think, back to your question, we Catholic healthcare are perfectly situated as a counterculture element to actually maximize the promise and minimize the peril.
Thank you, Dr. Roth. Dr. Milliken.
Thanks so much, Dr. Daly. It's great to be here. And for everyone who spoke today, I just have learned so much. So it's an honor to be in community with you all. And I come to this from the perspective of a nurse and clinical ethicist who now spends my day job is teaching nurses ethics. I also spend time still working in healthcare systems and doing healthcare ethics consulting. So I think a lot about sort of the way we can ideally prepare nurses and other clinicians to engage with these questions at the point of care. And I also spend a lot of time thinking about the downstream benefits and burdens of these technologies, both for our patients and for our nurses and our clinicians, more generally speaking. And I'm struck today by this tension that has come up both within and across talks, which I think you've just named really nicely. How do we manage the desire for innovation while also appropriately regulating? And I think there are lessons within Catholic teaching that can help us navigate that space very nicely. We've heard sort of the beginnings, the gestures at a framework, a set of principles that we can think through to sort of help guide the development and adoption of some of these technologies. I think of principles when I teach my students about ethical principles. I don't think of them as things that tell us what to do, right? They don't provide direction, but they provide us with a useful taxonomy to be able to label harms and benefits and to identify where tensions might sit. So I think one of the things that we're already starting to do, with the work being done here today, is to come up with an agreed upon framework or a set of principles that we can use to guide and decide when to adopt and when not to adopt technology. I think the part that is unique to Catholic teaching that really could usefully guide us here and then could sort of be adopted more broadly is this idea of discernment that we've heard come up a number of times. So we need a framework. We need some sort of agreed upon set of principles, right, to guide this work. But the practice of discernment, I think, is a skill that we can teach clinicians, we can teach patients, we can teach organizations to use as we're deciding, when do we move forward with something and when do we need to pull back? We get very excited by the technological imperative, right? And we've seen, I think your example of the EHR is a great one. Lots of other technologies that we use at the point of care that we've started to implement, and then we've suddenly run into ethical challenge. So I think about when the ventilator was first invented, when dialysis was first invented, right? We start using it and then we decide, oh no, we don't have enough machines. How do we decide who the dialysis machine gets allocated to? Or we've intubated patients, but then we decide after they've been intubated, oh, I actually don't know if it's okay to take the ventilator away. I think contemporarily we're running into these same sorts of issues with ECMO. That's the technological imperative, the can question going ahead of the should question, which is the ethics question. And I think we know, and we've seen today, that AI is so ubiquitous. It is everywhere. And I think we're at a very critical juncture where we need to be answering the should questions, trying to do that before we answer the can questions. And I think that's where the practice of discernment can be very useful and can be something that we sort of develop as a core competency among people we're training and among people who are in practice that really want to become experts in this space.
Thank you, Dr. Milliken. Dr. Pensino.
I think the key takeaway for me is the rapid progress and development of artificial intelligence, right? I think we've seen a lot of examples yesterday and throughout the day today, how fast it is moving. As Brian said, right, the AI we've been talking about as we started the Coalition for Health AI, and the AI of today, and even the AI of 3 months ago versus the AI of today with the agentic workforce, right? The examples of what agents can do and the autonomy that will be ascribed to them puts us in a very unique position that we need to prepare for, because the challenge is that technology is running out of ethical frameworks, right? So what can we do about it? And I think I very much agree with the other panelists that the Catholic Healthcare Association is in the perfect space for a number of reasons, right? It's I think the Catholic Church's cohesion of doctrine and ethical standards bring us together. There is power in numbers when you look at all the health systems kind of working together and working and speaking to organizations like somebody mentioned Epic, right? They say, we need this, right? That's a voice that will be heard. There is a component of sharing of best practices, right? So maybe one concrete outcome of this for CHA is create a sharing forum for best practices. I will say one of the most memorable presentations I attended a lot of conference of the last few years was Byron Young from Mercy, a year and a half ago, presented at the CHI event, their governance framework, deeply rooted in the Catholic ethics, right? Starting with principles. That was phenomenal, right? That was kind of, okay, that's what's needed. And I think I would, assuming that other health systems have something like that as well, right? But what does that framework mean today for agents and autonomous, we don't call them labor, don't call them worker, autonomous things, whatever the we'll end up calling them, right? What is it in the Catholic setting? And then the education, right? Getting back to the formation of the developer and user, and having the right programs, right? Kind of looking at the landscape, it's the programs either tend to be very much in the ethics and theology or in the technical aspects of it. We need more combination of it. So I'm involved with the Catholic International University, who just put out the Masters in Prudential Technology program, which tries to combine a master's program with 1/3 Catholic anthropology, 1/3 kind of product design principle, and 1/3 of the AI technical components, right? Bringing it together. And just one example, but we need to rapidly disseminate. We need to disseminate faster than the agents evolve, right? The moral principles, and how do we do it? So I'm kind of leaving the CHA with a lot of open questions and opportunities, but I think the need is real, and we on the technology side really need the close partnership of the ethics experts.
Great, so we can open it up, and Dr. Anderson.
I just wanted to come back to something that Dr. Roth said. So I was just in London, and in London, we were talking with the Ministry of Health, which is grappling with creating an AI regulatory framework that balances, the promise and the peril, as you described. And one of the tensions that was just palpable around the room of experts that they had assembled was, we don't want to be left behind in this race. This is a race that we're in. And here in the US, it's all about, we got to beat China. And I think, one number that is, I think, very sobering, probably should be to all of us, is, this year alone in the United States, there is nearly $1 trillion that is going to be invested in not just data centers, but, building these models, training these models, lobbying for these. And one of the things that, when I reflect on my time in Chai, it is really hard navigating policy at a federal level here in the US, because on the one side, if you're advocating for, regulation, somehow you're then therefore advocating to lose this race. And yet so many of us in the AI engineering space recognize that, there is a light and a dark to AI, right? There is great promise and great peril. And in the conversations that we were having in London, there were several folks that were deeply religious that were sharing, no, we need to be able to hold both these things in tension. And I just think that voice is so easily lost in the conversation here in the US, because, you have companies that are, very competitive, not wanting to get behind, one or the other. And I think as a community, I think CHA, Daniel, is really, just like Michael said, is really well positioned to be able to hold both those things in tension, right? The lightness and the darkness, and help us navigate through that.
If I could just say something, with regard to the rapid development of AI, we don't know where we're going with it. So we have no collective aim with AI. We have competing narratives around AI. And so I think one thing is we don't have a big picture. So it's just keeping up with the Joneses, so to speak, so that you're not left out. And I guess that is a question in terms of the Catholic narrative. The Catholic narrative has a narrative. It has an eschatology. It has something up ahead that it actually is oriented toward, which is what we don't have with AI. On the general scale, AI is just a kind of a free-for-all. And if you're really smart and creative and can really do cool things, well, you get the prize. And I think that's really problematic. Like, AI just lacks any kind of bigger picture, any kind of larger story. So on a large scale, it's just a competition of stories. The other thing I think what's neat, I do like the fact that we need to slow down. We're talking about speeding it up because we have to keep up with everything. But the fact is, if we don't slow things down, we are going to find ourselves in a very post-human world. And I think I wouldn't want to be too naive that the human person is remaining human in this rapidly AI developing world, because it's not true. We're actually complexifying with this AI. We're becoming something different with it. We're not only using it, we're dependent on it, that if it were to disappear tomorrow, we would disappear because we can't function without it. And so that's very problematic. And I guess the question is, I think we've kind of lost soul. We've lost a sense of a deep inner principle of life. We can't slow down sufficiently to reflect on what we want with this AI, where we're going with it, and what kind of humans we want to be. And, are we the kind of human that Jesus, was calling us into? So I guess those are my questions that I have more than anything.
If I can respond to that and to Brian's point, I've lived at the interface of technology and care and operations for better part of 2 decades now, and important always to sort of understand your why, right? Because technology can be done for technology's sake. It's very easy to do, right? But technology that's purpose-driven is the most important thing, right? And so to your point, if I were in any field, even for me, I don't want to fall behind either, but I don't want to fall behind for the right reasons, right? Which is we have this imperative of what we owe the patients and communities that we serve every day, right? And we have gaps today. And so there are ways that we can use technology and use AI as a new technology to do just that. So we should be upfront today, to your point, defining what it is we need and what our patients and communities need. That should be the first question we ask, not technology first and what can technology do, but what are the gaps? And let's really focus on those gaps and then apply the technology sharply to that. I think that will help us minimize some of the risk and really focus the efforts and ask the right questions.
I just want to add, just to add, I think the first part of your question is really important. And one of the things I would offer is that when we're talking about, sort of narrowly speaking, I guess, AI within the healthcare space, we can think about the goals of Catholic health, the goals of medicine, and the goals of nursing, to your point, both as a compass, right? What are we working toward? Where are the gaps? But also as an evaluative metric. So we can say, does this technology help us to achieve those goals? What are the potential pitfalls of this technology that might detract from those goals? And so if we can, to your point, sort of guide advancements in AI within the healthcare space toward established professional norms and Catholic values that we have worked with over hundreds of years, we help to eliminate some of that sort of like free-for-all perspective, I think. And so I think that can be a useful framework for thinking about some of these questions.
You mentioned being countercultural, and I'm curious. I'm thinking about Louis Kim's presentation earlier, and he was saying, well, hold on, we've seen counterculture before, and it doesn't age well, right? The crossbow and all of the other examples. It reminds me of H. Richard Niebuhr's book, Christ and Culture. Those of you, this is, the theologians and ethicists may have read this book, and he's got all this really extensive typology, and he said you could be Christ against culture, where the Christian has to be against the culture, or Christ kind of accommodating the culture, but then Christ can transform the culture. And I'm wondering what model is it that the values that we're talking about, and to think about Monsignor Pegararo's call to have these values engaged in a larger dialogue with the global sphere, not just held within the Catholic space, but see, where can we meet? Is it to transform the culture? Is it to be against the culture? What's the relationship to this AI culture that's developing? I find this to be a fascinating question.
Well, I would take Jesus as a model, quite honestly. I mean, I think Jesus himself was kind of countercultural. As a young Jewish man, he was really challenging, the laws and, living within them, and yet pushing the boundaries of them. For why? For a new vision of what it means to be a human, not just a person, but a person called into community. And I think that's what the countercultural is. We live in a culture that is extremely isolationist and individual. And AI is actually exacerbating the individualism and the tribalism. And it could do otherwise. It could make us more communal, but we're not using it in that way. So I do think that this counterculture it's to see in a new way. I think we need vision. And I think Jesus had a vision for a new way of life. And that's what we don't accentuate, I think, within the Catholic values. It's not just that, the human person is distinct and special. It's that we are called into something more than what we are now. And I think we can build a new world with AI. AI is not the problem, in my view. We're kind of the problem, because we don't really know what we are. And I think now we're on this treadmill with AI that we can't slow down and catch our breath to say, what are we as humans? What are we called into? Honestly, even, many people spoke about relationship or relationality. Jesus was all about relationship, but particularly relationships of inclusivity, community. We've alluded to that here, but Pope Francis was, very insistent on interdependence. But we live with AI that makes us very independent. We don't need people because now we have the machine or the agent to as an intermediary for us. So do we really need one another? Do we really need this earth? That's our question. And I think, how do we use AI? I think we have to shift the emphasis. We keep orienting ourselves to AI. I think we have to orient AI to what we are called into. We're the ones that are building the earth, not AI. So I do think countercultural is good, but we also need a vision to what that counterculture is.
A slightly different perspective. So I view AI as a tool, and it's created by humans, and it should be viewed as a tool that we ultimately should continue to have control over. Louis and I and a few others in the room had the privilege of visiting the Vatican and speaking with various officials earlier in December about AI. And one of the takeaways I came away from those sets of meetings was all of the major AI companies want to get like the approval, the stamp of approval from the church. And so if I think about, what is the opportunity here for us, right? We can either be the thermostat or the thermometer, right? And I think the opportunity here is if we want to influence this tool that we're creating, we have to speak into that and meet the developers in a way, where they're at. Like, okay, so if they want to get the buy-in or the approval, well, then we should articulate in some way what it is our vision, our North Star is, right? Right? So we hear, I think, very high level principles, human dignity, right? That is a important goal that we want this tool to affirm. But what does that mean for the developers at the big tech companies? I think there's a real opportunity for us to speak at a more technical level, and maybe I'm biased because that's where I live and breathe, what that looks like. And I think that is a path to influence and to be that thermostat to help guide the development of these tools.
And what I would add, right, there is the development, but the tools are just building blocks, right? Working with some of the companies, they were kind of stressing it very emphatically that we're giving you the Lego pieces. Oftentimes, we may or may not give you the instructions, and it's on you to build it if you're a health system or any user organization, right? So I think it's again, the responsibility is as much on the developers as it is on the implementers. And again, Catholic healthcare, right? It's what kind of AI and for what, right? To your point of what do we want to use it for and how do we want to use it? So yes, we need to engage in dialogue with the developers and work closely together. But the responsibility, in my mind, is increasingly shifting to the users because ultimately they have to sell the product, right? That's the goal, and I think that's our opportunity is to define what products we want.
That's right. So I think I agree with that, and then I would add to that, which is So it is not enough for them to say, here are the Lego pieces. And it is 100% true that it is on us, the implementer, right, to be very clear about what we need and how we need it and what's important to us. But to build on that and going back to using the failures of electronic health records as an example, it's actually having a collective conversation with everybody around the table collectively with a shared perspective about what great looks like and what are the fundamental principles that must apply as we do it, because it is not enough to say, here's a bunch of Legos, build a castle. It is important for everybody around who are creating Legos to understand their purpose built. I appreciate your analogy of a thermostat, and that's what those principles would define. And I'm dying to ask you a question, which I won't, is that because we need those technology companies to want that seal of approval for all the right reasons and not the wrong reasons. And it's a broad statement. Some of them will want it for the right reasons, some for the wrong reasons, but we need them to want it for the right reasons as an entrance point to being at that table.
I guess the question is, do they want the stamp of approval for its own, just to get the stamp so they can market that? Or do they actually want to be aligned with the values that the Vatican is going to hold them to? I mean, that becomes the question, right? Is that, this is just a marketing ploy, if this is, Vatican washing, and I don't know if I've ever heard that term, but, we know greenwashing, the little stamp on the thing, Vatican washing of AI, then it's meaningless, right? And so I think, how do we help to transform those developers so that they're building the products that actually do recognize the person and do fill the gaps in healthcare that need to be filled, and there are many. So we have a time for a few more reflections from this group, conversations and talk among the group, and then we'll turn it out to the audience. I don't know if there are any other comments that we have in this esteemed roundtable.
One more thing, and I think it's the way I hear the discussion in terms of AI and human. And I think one way helpful, the new literature today is on AI, Gen AI. We're entering, children born in 2022 will never have known a world without AI or AGI. So your patients in the future, this will, talking about the human person apart from AI is going to be foreign to them. They will only know the human person as part of a matrix or a web of AI. So how do we create a value system, a Catholic value system, in which it's an AI human partnership? In other words, what we are and how we're using AI, what it's about is not just a thing for us, but it is with us. So it is, I think we do have to come up with a new set of criteria for what is AI? Does it have legal rights? Does it have, we talked about this a little bit here, moral rights. I mean, if AI makes a mistake, who's held liable for it? But even as I listened to the doctors this afternoon, it's a partnership going on there. It's not just the doctor and the machine, it's the doctor machine, in relation to so I would say that's one area that needs a strengthening in terms of the values from the Catholic tradition.
Can I hear what you're saying, and yet part of the challenge, so much of the disparity in the US in healthcare is lack of access. And so when we think about the promise for AI, I think one of the things that really excites me, having grown up in a rural community, is enabling an agentic tool who has, relatively no human in the loop, be able to meet a patient where they're at. And I think in that there's this tension of how do we recognize the human dignity of the patient, respect the patient-doctor relationship, and yet not knowing that there is this profound scarcity and access issue of providers deliver AI in a way, that reflects the human dignity of that patient, cognizant of the issues and concerns that AI can cause harm. I'm not saying we figured it out, but I think I don't want to be scared of walking into that space.
Totally agree. And just one more thing. We humans want to avoid the messiness of being human. And AI is very clean and neat and very efficient. And it's precisely in the messiness, the suffering, the ambiguities, where we get things wrong, that's where we're most human. And that's what we're trying to avoid. And that's where I think we need to kind of reevaluate what we're doing with AI. Sorry, I love it.
I just on this point of, I think the possibility of AI being able to increase access is very important. And we know that from a social determinants of health perspective, a lot of health inequities are driven by lack of access. And I just wonder about reframing your question, and rather than asking, could agentic AI create a world in which a human in a rural area interacts with an agent and receives their healthcare in that way, we could sort of flip the question to say, what are the goals of healthcare? What are the goals of medicine? What are the goals of nursing? How do we want to effectuate those goals in these rural spaces, right? How do we want to get medicine and nursing to a person that doesn't have access to that? And then in what ways can AI help us achieve that aim? So rather than asking the AI first question, you're asking the goals of healthcare and goals of medicine first question, and using AI as the instrument to help achieve that.
And that's what I mean by the problem, right? And what I meant earlier, because we constantly fall short, right? Because we said 20 years ago, we were going to be safe and equitable, right? And accessible and affordable. And we are anything but that today. We fall short of that every day. And I do think, to your point, Brian, the promise of this, using rural as an example, is we are at a time when we'll have the ability, more than any time that I can remember, to actually come closer to those aims. We just have to do it in the best, right, just, ethical way.
Amen to that.
And the hope is that the technology is used for those purposes, right? I mean, getting poorer people access to healthcare could absolutely be one of the outcomes of this technology. But if it's leveraged for what it appears to be leveraged for, which is profit, those people are not payers in the sense that you're gonna drive a lot of profit out of them.
That's right.
Right.
Our job.
And that's it. And I think that's the key, is that if this is leveraged just as a tool for the generation of wealth for a small number of people, it's not going to drive access. And I think it's our job to move this group. That's the transformative piece, I think, that to transform the development and use of the technology toward the ends of medicine, toward the end of nursing, toward the human good and human well-being.
And building on that, I think the event that Lewis referenced in Rome, right? We came up with the rubric. I think Lewis had a slide where the alignment of healthcare organizations, the goals towards we want to build: access, affordability, and quality of care, right? Those are the three. And then we juxtaposed it versus the Catholic social teaching principles and said, okay, you put a matrix like that and try to put the AI applications right in that starts bringing a framework, which I think, again, to your point, is not saying, okay, it's how do we use AI, but no, what do we want to accomplish, right? And then how AI can be helpful in that.
Yeah, what's the goal? And then how do we get there? And how can AI help us achieve that goal? But start with the goal in mind.
Well, okay, so let's open it now to questions from the audience. And I think we have a microphone that can be passed. And we have another one up here that I can pass to a graduate student. And so we have a question over here, please.
Thank you for a great conversation. My question, I guess, is more self-regulatory, organizational ethics. In light of the impact that we're seeing AI have ecologically, but also on the dignity of work and the dignity of worker, should Catholic healthcare ministries self-regulate the use of frivolous AI use?
Within healthcare, yes, 100%. Because that's what we mean by, right, the appropriate use, having the right why, right? And so, yeah, this needs to be laser focused, right, surgically focused, as it were, on what it needs to be. And so to the extent that frivolity lives outside of that, we absolutely should self-regulate to that end.
Yeah.
My 2 cents.
I think I agree. And I think one of the things that's oftentimes overlooked is when we think about evaluating these models is the ecological impact, right? Like I've seen so many evaluation frameworks that don't take into account how much electricity does this consume? What is the cost of it? And I think the more that we include those kinds of components in an evaluation, the better we'll get a handle on when to use a model and when not to use a model as it relates to our ecology.
If I could amend my point, and to prosecute that same frivolity outside of Catholic healthcare.
Yeah.
Right, and use our voice to make sure that people aren't building it with frivolity, right? Because we have a voice there too. It's not just internally that we need to self-regulate. We have the opportunity to have influence outside of for that same purpose.
Four seemingly disparate observations, and then a question that I'll go through quick. A question that may be more rhetorical. So, observation number one: during a breakout, asked ChatGPT to go to the Reddit forums for Catholic hospital systems, biggest ones, Common Spirit, the biggest ones. What are employees saying? So maybe you won't be surprised. They love their team. They hate corporate. Number two, when I think about the theory of change and impact long term of all the things that we're talking about, it seems, I think about like certain knobs that you would kind of like dial up or down and think about the impact. It's clear that the true impact is going to occur within systems where patients go through, doctors work. It's sort of obvious. Within a system, the other knob of change, I think, is leadership. C-suite, the staff below, a couple levels below, better for worse. That's where change sort of is really driven. Fourth point, last point, is to Sister Delia's point. I mean, we don't know really what's going to happen. AI is a current shock. 10 years from now, it's going to be another shock, another shock, another shock. So then in systems theory, it's resiliency. And how do you build resiliency in the factor that drives the biggest impact? That's leadership. And I think it is formation. And maybe this is a time for CHA, being the kind of organization it is and where it can influence, to revisit mission formation in a pluralistic world leadership suite. So.
Thank you, Louis. I was going to wait to the very end if there was time to say this, but this is just to tag team on what you were talking about. I was in Chicago before I came to Boston with 52 executive CEOs, sponsors of Catholic healthcare who were going through an 18-month program on formation. And it occurred to me as I was listening to you speak, how do we form AI through our lens that we do in Catholic healthcare for all our executives and our middle managers and our frontline workers? We have been doing formation for 30 years in Catholic healthcare. And we recognize that people come to our ministries with gifts, skills, and abilities and competencies, but that's not enough. We say that they have to be formed in the tradition, in Catholic social teaching, in order to enter into this milieu of Catholic healthcare. So I'm coming to the understanding of what is our role in helping form AI. And through mission into all of what you said. One other point I want to make is right after COVID, our CHA board went through a process of articulating a new vision. And the vision is we will empower bold change to elevate human flourishing. And I think at the heart of that is what we've been talking about. Our goal is human flourishing. And that's in the reimagined space of healthcare. It has not been about human flourishing, it's been about curing. So we have 3 goals. And all 3 of those goals have a space for AI. The first is on access to care. The second is transforming and reimagining healthcare in the lens of whole person care and human flourishing. And the third is united for change. And I'm hearing that call as what role does Catholic healthcare play in being able to advance this work? So I just want to lend that to the conversation.
Can I just make a point? So completely agree with you. In CHI, we actually have a project focused just on human flourishing in health AI. I'm proud to say Byron is the co-chair or chair of it. I would encourage any healthcare association or health system that wants to be part of that conversation to participate, because I think what we're doing is exactly what you're describing. Thank you.
Other responses?
I have also a couple of reflections and a question, maybe a bit provocative. I'm a senior research scientist at MIT, just to give you context. So first of all, right, I think it's very incorrect to call AI, or specifically Gen AI, a tool. You're not going to bed with a calculator. You're not waking up with a calculator. You're not talking to a calculator about your biggest fears. So I think that language and vocabulary are very important. And we do need, I think, especially in these types of formats, to be very specific about language. We don't need to have technical background, right, in this. And of course, there's separation between AI and Gen AI. I believe Sister Francisca actually made the point. So I think very important, AI is 70 years celebrated last August. Gen AI is 4 years, 3.5 years now. But back at this point, right, this assumption that in its infancy, we don't know what's going to happen. Well, 10 years later, after social media hit kids, right? We have Australia and also other countries joining the ban, right? There is not a single paper on the surface of this planet that tells that social media is great for education, just as an example, right? I don't think we need to wait another 10 years, because that will bring us to the movie Idiocracy, for those who know the movie, right? And back on the point of, oh, there are users and we are not users. We always tell people who come to us to the lab, if you don't have your own GPUs, if you don't have your own data center, if you don't train your models, you are the user. I am sorry, that sounds very bad and brutal, but you're using it. You're using a fancy wrapper provided by someone who told you that it is HIPAA regulated and someone who tested it using Grok, right, that said that it is HIPAA regulated. So I think it's very important to have vocabulary strictly figured out. But my question actually, and this is based to my final point, is about time. I heard time and time again during this conference that this opportunity to give back time, to save time, which is wonderful, but there are multiple papers saying that time is not being saved, by the way, that actually you do need, if you want to do it right, check all the nodes and validate it. So it's most likely actually more time that you are spending. So this is very questionable just as of now. So the question is, with all of that you know, don't you feel like you are, in some cases, and I'm talking here to practitioners and medical practitioners, making a bit of a sacrificial lamb on giving you a stamp of approval to the patients who come to you in their weakest state, ultimately, because otherwise they would not be in front of you, right? Let's be very honest. They would be as far away from you as they can, right? They come into this most expensive system in the world, right? United States, obviously healthcare, and you are giving them a bit of your stamp of approval, showing that you have Gen AI, whatever is running on your machine. They obviously don't have always the knowledge to understand that what they came with on their phone is different from what you are having, but you are showing them as someone who has, in this specific way, actually power over them, saying, oh yeah, it's okay, use it. It's gonna be great. So this is, I think, the point is some of this language that I was hearing very much goes into, it's okay, if you're not gonna use it, you're gonna fall behind, but I feel it's more formal, this fear of missing out, than actually investing more in people, in medical system, so we actually have more people who will support other people and go and talk to patients. So how do you feel about that? Like, don't you feel that it is a bit of complacency here that is happening? It's a bit provocative question, of course. So yeah, I would love to hear your thoughts. There you
I'll start. I think so. Complacency, asking you back to something you might about complacency, and as much as that we're relying on technology when we could be investing in people. Is that paraphrase your point? So
Gen AI.
fair. Yeah, I think I agree with you in part. I think we have to be very intentional on what we're using it for and how we're using it. To your point earlier about when you give people time back, right? We have to be intentional about what do we use that time for, and do we use it for good, right? We've learned a lot even in the last year or so, right? And things like ambient listening about what we do with that. And we've made mistakes along the way. I mean, to embed those mistakes going forward so we don't make those mistakes again. I think we have to do that. But I think we also have to come to the realization that there's not going to be enough people. I think that's to your point.
Mm.
Yeah, so tell your friends to join healthcare because we don't have enough physicians, we don't have enough nurses, we don't have enough pharmacists, we don't have enough people to meet the needs of the people that of the service that people deserve, and they owe it to them. And so, yes, I would love to have more physicians and more nurses and more pharmacists in the country, but here we are, and we fall short every day because we don't have enough, and we ask too much of the people that are there. So I think we do have an obligation to find ways to use this safely and effectively and efficiently, including AGI, to do just that, because we're not going to be able to get to enough people. I wish that weren't true.
Just on this question of time, one of the incredible benefits that I think we've seen elucidated very well today is the way some of these technologies can alleviate documentation burden, right? And that is a huge burner of moral distress, which is one of my areas of research, of burnout, of attrition. People are leaving the bedside in droves in the wake of COVID still, now 6 years on, right? So figuring out ways that we can improve the work-life balance of people in healthcare is incredibly important, independent of AI. The other worry that comes up when I hear about these incredible advancements in time-saving technologies is the what do we fill that time with question and the surveillance piece. I think would be very easy for health systems to slip into, well, we've saved you X amount of time on documentation, so we're going to add X more patients to your schedule. Or you're spending too much time talking with patients, and we know that because of the ambient listening scribe that you have, and so we need you to change your practice in X, Y, or Z way. And so I want to be optimistic that we're using these tools in ways that are beneficial to the clinician, and hope that we won't start using these tools in ways that actually, in saving time, end up adding back onto the sort of workload and the burnout of people at the point of care.
And it seems to me that your question really gets at a larger structural problem. I think what the systems are doing are dealing with reality as it is. And they have patients to care for, and they have professionals that they need to hire, and they can't overburden. And so they're looking for solutions. But this exists in a larger structural context. That is, how we educate medical professionals, how we credential medical professionals, that Dr. Roth has no control over, right? You're at the mercy of the systems, and then you've got to try to care for the patients given these structural constraints. I think it speaks to a larger question. I think it's a really good question that goes beyond the question to the leaders of healthcare, Catholic healthcare, to, this is a question, this is a political question about, and that goes beyond medicine even. And I think it's an important one that needs to be answered. And I know there are a couple of responses here.
I actually have a question for my colleagues here. So, one thing about being human is we can imagine what doesn't exist and we can bring it into existence. We can create it. So what would Catholic healthcare look like if we were to imagine something that doesn't exist and bring it into existence to amplify or deepen the values that are at the heart of this tradition? I mean, how might we develop AI across these various healthcare systems? How might we imaginatively or creatively link them? Or I don't know. They seem very complex right now in themselves, but I'm just wondering what can be created that doesn't yet exist in terms of Catholic healthcare.
I mean, I think I was going to say this, and I think it speaks nicely to your point. If we can use the time-saving mechanisms well and safely and equitably, then not only would we alleviate burnout, which would help to minimize attrition, it also could help attract people to the field. If we bring sort of the human aspect back to healthcare that I think has been lost through decades of EHR work. It might actually make healthcare more appealing and therefore have the consequence of that drawing people in. Or, we know that most new grad nurses leave their first job within 1 to 2 years, sometimes leaving the profession entirely in a very short period of time. That's post-COVID data. So we really desperately need to rethink what working in a healthcare system looks like. If we can harness some of these opportunities for good, I think that's an imagined world in which healthcare workers benefit and by extension patients benefit.
And reflecting on your point, and one we talk about, but is hard, is so one of the reasons it's hard to be a patient is we do relatively well in an exam room, in an emergency room, in an OR. We do terribly in between those areas. Right. And I think there's an opportunity for us to be intentional and purpose building a system that actually helps patients navigate what we call the white space. Right. And freeing up time for clinicians and caregivers to do just that and to be the people part of that, but to have technology enable it for them so that patients have a place to go that they can rely on, that we can put forward to them that's effective and safe and appropriate for them to navigate their own health and to maximize their ability to manage their own health in ways that we just disable from them today.
I would just quickly say in the AI space, it's about articulating what our values are, right? And then solving that alignment problem in the AI space. That is something that we have not solved in the generative AI space. And I think that's what's urgently needed. If we want to create that thing for the future that is aligned to our values, we need to solve that.
So we have time for one more question. I know Andy had his hand over there. Or did you already? Okay, you. No, well, in the black turtleneck, you can please do a short question, and then we'll have another short question.
I guess in that sentiment, right, of we have to be the best version of ourselves for this to go well. And I think it's at a point.
Yes, it's on.
It's definitely a mirror of ourselves. And I think we've reached a point where we can't even recognize ourselves in the mirror. And so I don't know if you guys saw, but NVIDIA just rolled out the robot Olaf. I imagine that wasn't cheap. And if we're going to be the maturest version of ourselves, I think we should dedicate all of that capital and money and resource to helping each other first before we just throw it into entertainment and keep going. So I'd love to know, like, I think it's one thing. I come from the opinion that we have no idea how this is going to play out. We have no idea if it's going to get control of a nuke by just someone giving it the wrong direction tomorrow. And there it goes. Like, and I know that's to the extreme, but there really is this. You talked about the Bible as a narrative, and that narrative is about good and evil. And so are we at a stage where we should maybe have the conversation that this is spiritual warfare? This is a technology that challenges every ounce of our being, from the mental to humanoid robots, which will be the physical. So I guess, how do we actually come together to be the best version of ourselves before handing it off to the technology, even though I think those mechanical horses are already out of the gate?
Final question.
Not a question, just a brief build on this question of what can we imagine that we could put into the world, harness things that I first learned when I started to learn about healthcare. It's this way.
That
is that okay? When I first started learning about Catholic healthcare, I learned this phrase, the walking nuns. I love that phrase, this idea that the original sisters would walk through communities finding the vulnerable and engage with them with love and guide them to good health. And I read this morning that there are now 100 million health-related questions being asked to ChatGPT per day. Now that it didn't surprise me because there's been 100 million health related questions asked to Google in the Blue Link world for a long time, but now all of a sudden, ChatGPT, a chatbot is being asked these questions, and so I just wonder, in the spirit of the Walking Nuns, if they were to come here today and try to find the vulnerable, what new place might they find them? And they might find them right there. And if they could engage in a conversation at scale by what you just said, which is, I'm sorry, I forgot your name, Mr. Executive from Trinity.
Yeah.
Yeah, I'm sorry.
No worries.
But you just said maybe we could train an AI model to be able to go there and have that kind of dialogue at scale, not for the purpose of delivering care, but for the purpose of meeting the person where they are and guiding them into the person, the provider that's going to deliver them that kind of miraculous healing experience. So just a thought. And my final thing, Dan, thank you. This has been amazing. Absolutely. I know you're not closing out yet, but it's been amazing. Thank you for doing this. And the one thing that I was anxious about until just this moment was that on this time dimension, it seems like there are certain things that we ought to be really urgent about, that we ought to be really chasing AI quickly, decisively, aggressively, because we can validate that it can do good. There are certain of those use cases which would be a nice tension here relative to all of our right caution for the technology. So thank you.
Final comments from our esteemed roundtable.
Just say, I want to thank the many people who are here and the great work of Catholic Healthcare Association. I was not really familiar with a lot of the work, so I learned a lot today, but I work at the intersection of AI and human becoming, and I think it is a carpe diem. You know, we have to seize the moment that we're given right now, and I think it's a call. It's not just a carpe diem. I think we're being called into something, into a new future, and I think that's where we do have to be proactive about our values, what we commit ourselves to, what we have faith in, and what we hope for.
Well, that's a really great place to leave it, Sister Ilya. So we're gonna leave it there. Let us thank this great roundtable conversation.
Wow, what an incredible panel and conversation, questions from the audience and responses. And great job moderating, Dan, by the way.
Thanks.
We're each going to give just a couple of quick takeaways. We're going to be pretty brief, and we'll wrap things up here. So I'll start with my first takeaway, and it's kind of based on a comment that Vardit Revitsky, who is the CEO of the Hastings Center, made the night before in responding to Monsignor, now Archbishop Pecoraro. And her comment was that the questions that are coming up around AI are essentially existential. There are questions about who are we? And if you want to get technical, they're anthropological questions that are being raised philosophically and theologically. And so what does that mean? You know, AI, part of, I think, the challenge when I did research in this area and listened to this panel is that it looks and acts so much like us that it raises the question about what is the distinction between us and an algorithm, between us and a machine, you know? And there are different answers out there. And I think there are particular answers that come from the Catholic theological and ethical and intellectual tradition. So I do think that's kind of the first thing is I think those are the core questions that we can raise and are raising as a center and as the Catholic tradition broadly understood. And it really then the questions about what do we want to do with AI? What do we want to create? Flow out of those questions about who we are. How do we want to shape the technology and not just allow it to shape us, because it does work both ways. That leads into a kind of a second related point in my mind that there's like an underlying thread that was being throughout all the different comments, like an underlying question that I don't hear being asked in other contexts. And I mean, when I listen to the news or read things online, where the focus is very much on the tech. And I think in Catholic tradition and Catholic healthcare, there's a question that gets raised, and that is, you know, not just about efficiency, but efficiency for what end, right? Or technological advances for what end? It's the question of why. It's like, what is the final goal or purpose of all of this? For those listening who have some ethical training, you'll know this word teleology from Aristotle and Thomas Aquinas. It's the question of a teleological analysis is always asking, what's the end or the purpose for which we're doing this? And I would say broadly, Catholic anthropology and ethics is never satisfied merely with questions of efficiency. We always have to ask those questions. What is the purpose or end? And of course, those are always going to be rooted in serving human dignity, serving the common good, promoting human health. And then my last comment is, though I saw a lot of focus on this idea of discernment. Like the technology is advancing so fast, which means that the ethical reflection and the philosophical and theological reflection is advancing fast, almost to the point where we can't keep up. And so some of the panelists used the word discernment explicitly or directly. Some of them didn't, but we're still talking about it. And that really comes down to asking those questions that I talked about in my previous point, like what's the point? What's the purpose? What's the end? And if you're a leader working with these technologies or an ethicist or a computer scientist, it's not a skill that we're trained with unless, again, we've, spent some time in these spiritual contexts. But it's what we see these really thoughtful leaders doing, asking the questions about discerning how and why are we using this? Which technologies do we want to adapt? Should we adapt? And why should we do that? And so it's happening on the ground, but I think we can give some language to that. And I see the panelists doing that. And then just kind of a footnote under that one, a lot of times this becomes like a formation question. So people running formation programs, you've got these absolutely brilliant people trained in business and technology. We can help to introduce some of that language around discernment, around what is the higher purpose. And so I think those are kind of the unique things that I heard coming out of that conversation from the panelists. And again, arising from looking at this cultural phenomenon and moment through that broadly Catholic theological and ethical lens. So yeah, what about you, Dan?
So yeah, I mean, I think Tom, one of the ones that you mentioned was this focus on ends and aims of healthcare. What is healthcare about? And centering those aims and ends, and that AI is simply a tool to promote those ends. It's a means, not an end in and of itself. And really, the burden of AI is that it's got to prove that it can promote the ends of healthcare, which is patient well-being, flourishing, and healing. So this decenters the AI and it centers the patient and like the nature of medicine, the nature of healthcare. I think that was a resounding theme throughout the entirety of the conference. Another one that we saw, especially as the conference continued along on Saturday, and you heard it in the session that we just listened to, many people were looking to the Center for Theology and Ethics in Catholic Health, the Catholic Health Association, but also kind of Catholic healthcare in general for leadership on these issues. There seems to be a vacuum. There seems to be a need for a group or groups that are interested in patient well-being and flourishing to be evaluating and looking at AI. And I think what people saw during this conference was that that's happening in the conversation we had, that the center is convening, that CHA is interested in convening, that Catholic healthcare overall is interested in. And so this is both kind of within Catholic healthcare, but I think it goes beyond Catholic healthcare. I think we have something to contribute to that secular discourse on centering just as you have noted, centering the patient, centering the nature of healthcare in this. And Tom, you and I have certainly agreed that CTEC is going to remain a dialogue partner and a significant convener of this conversation, and hopefully a consensus builder going forward. And we have ideas in the works to continue that, so please do stay tuned. Another aspect that I saw emerge, especially with Sister Ilia de Leo's comments, which really got me interested. She talked about having and creating a counterculture. The Catholic healthcare or Catholic theology in general could approach this with a countercultural stance. And there's a part of me that's sympathetic to that. When you see the directions that some people want to take AI, whether it's in healthcare or otherwise, you want to, there's almost a knee-jerk desire to push back. And then it made me really consider, so I appreciate that. I appreciate that she brings that up because I think it needed to be brought up. We need people who are willing to kind of push back against the direction of culture at times. But when we think about the church in the post-Vatican II era, it has been really focused on the transformation of culture, to bend culture, to meet the human person, to promote human flourishing. That we don't reject AI, rather we are going to create a conversation and create norms and values and discuss it in a way that moves it toward authentic human value. And I think that is where the center is on this. I think we want to be a member of this transformation of culture, and I think that's where our listening audience largely is, where the conference largely was. And then finally, the last question is a question we always have to ask in Catholic healthcare. Who's going to benefit from this? Who benefits? Who loses out? Are there people who lose out? Does this expand access? Something I know, Tom, you're incredibly interested in, and we are at the center as well. What about those patients who aren't "quote unquote" centers of profit? Will they get to reap the benefits of AI in their care? And I think that's a question we have to take very seriously. We can't even provide basic care to all of the people in this country. We have the most advanced healthcare system in the world. We have the world's greatest wealth, and there are people who are left out. And my worry is that this will be mapped onto that AI will simply reiterate or even exacerbate those inequalities. And that would be a massive failure, a massive moral failure, not technological failure, but moral failure. And so we have to ask these questions.
Absolutely. Yeah, I think Brian Anderson spoke directly to that, ways in which this can be used to expand access, especially in rural areas. But that doesn't just happen, right, spontaneously. It takes intention. It takes a goal to go back to that. Yeah,
that's right.
Really great takeaways. Thanks for sharing those.
Yeah. Well, Tom, it was a great conversation that we had at Boston College, and I'm glad that we could share this with our listening audience.
Yeah, me too.
So, for Tom Bushlack, I'm Dan Daly, and this has been Ethics on Call. You can find this podcast on YouTube, Spotify, Apple, and our website, theologyandethics.org/podcast. And if you're on one of those podcast platforms, we would ask that you follow or subscribe to our page and leave a 5-star review and some feedback about the show. We would love to hear from you, and we will talk to you soon.